We're here debunking the greatest medical mysteries.
Today we're going to debunk Q-tips. No!
Whoa.
Let me ask you, what really makes a good doctor? If you're not happy, how are you supposed to help your patients?
We are honored and blessed to be joined by Dr. Gary Linkoff, New York City ENT specialist and facial plastic surgeon. Dr. Gary, talk to us about Q-tips.
So Q-tips can be dangerous in the ears because they can scratch up the ear canals and they can cause damage to the tympanic membrane, which is the drum of the ear. And so I always recommend that patients not use Q-tips in their ears.
Is there a better way to clean your ears than Q-tips?
That's a great question. I oftentimes get asked that, and the best way to clean the ears is to use Debunks, which is a softening agent for earwax. Once you use that for about 1 minute in each side, about 10 drops, you then take a bulb syringe, which is what little kids use in their, what we use for little kids in their nose to clean it out. You go into the shower, you fill up the bulb syringe with warm water, and you splash it into your ear, cleaning the ears out. I recommend people who are heavy wax builders use that once every 3 months for several days in a row, and that really cleans out the ears, and then you don't have to go to see me in the office.
Cool. So rewind, you said Debunks. If you were someone who's a big earwax builder, where would you find Debunks?
So Debunks can be found online. You can go on Amazon, order it there, or you can go into really any pharmacy, any local pharmacy will have it as well. What it is it's a hydrogen peroxide formulation, so it's basically just a diluted form of hydrogen peroxide, and it works really well for breaking down the wax. But if you don't use the water irrigations to wash out the earwax, it'll just reform after you've used the drops. So it's critical to use the wax drops, but also to wash out the ears.
The wax just pours out in the shower once you do the squirty thing?
It really does. It really does. You splash it into the ears, and then you watch the water with wax coming out.
How long do you have to use Debunks for?
So you use Debunks for about 5 to 10 drops per ear, and I recommend that patients get on it for once a day for 3 days in a row. You really don't need to be on it for longer than that, and then every 3 months. So you repeat it every 3 months for 3 days in a row, once a day. That's usually the regimen that I give my patients.
Got it.
Okay, follow-up question. So say the Debunks doesn't work, or you're a super wax builder. Are there any surgical options or people that come to you for procedures? Tell me about that procedure.
Yeah, so it involves basically under a microscope taking out the wax with a certain type of little instrument forceps. So you remove the wax you pull it out, right, exactly, with a curette and some forceps instruments, and sometimes you can even suction it out in the office. And that's the definitive way of really cleaning out the ear and making sure that there has been no damage and that the rest of the ear looks healthy.
Is this procedure painful?
Cleaning wax, for the most part, is not painful. I do recommend that patients try the Debunks at least right before going to see the ENT, because if you don't and you have very firm, hard wax, it can be uncomfortable to completely clean it out. But as long as it's softened with the wax drops, even if you're not washing it out, it's fine to have the wax suctioned out, and that's a fairly painless procedure.
So I know a lot of people are going to be asking, and like myself, I love Q-tips. I think they feel so good when you're scratching the inside of your ear. There's nothing like it. Is there any replacement for Q-tips or something that you can clean the inside of your ears with, or do doctors recommend that you stay away from it completely?
I would recommend avoiding any instrumentation of the ears. So there is a category of patients that just get really itchy ears, and they're saying like, well, I need to just pick at it with something because it gets so itchy. And what I recommend for those people is to just use some mineral oil or even olive oil. You buy a little dropper, couple drops of mineral olive oil can go a long way. You can do it once or twice a day, a few drops right down the ear canal, and it really soothes the inner lining of the skin. The skin on the inside of the ear is very sensitive, and so if you're using any antibiotic drops or heavy duty drops, it can really dry the ear out. So I wouldn't recommend using something that you found on the shelf of your home, but some mineral oil can really be helpful to soothe the inside ear skin.
Olive oil in your ears, I love it. Love it.
That's right. That's right. Multi-purpose.
All right, folks, you heard it from Dr. Gary Linkoff, ENT, facial plastic surgeon. Do not use Q-tips at home. If you have waxy ears and you want to get rid of that buildup, Debunks. Join us on our next show. We're debunking more medical mysteries. If you like this video, please hit subscribe and check out my boy Dr. Ben Kletchman and Dr. Gary Linkoff on Instagram. Dr. Gary NYC.
Yep, exactly.
See you next time, guys.